If you'd like to listen and learn about a number of different ways to use and create sensory substitution effects for your stroke survivor and to benefit the rehabilitation and the recovery, then the information in this video will be very useful to you. Hi there, I'm Dr. Kenneth Monaghan. I'm a university lecturer, I'm a neuroplasticity expert, and I'm the author of Lights, Mirrors, Action, a guide for transforming the lives of caregivers and stroke survivors. I'm also hugely passionate about trying to assist caregivers and stroke survivors to make their home the best or an ideal place for them to carry out their physical rehabilitation after a stroke. So sensory substitution effect is the idea that when one sensory information or information that goes from our brains doesn't work so well, can we substitute it with other information, other sensory information? And the example that Norman Doidge gives in his brilliant book, The Brain That Changes Itself, is of women who lost the use of their vestibular apparatus after they were pregnant and were on an antibiotic for too long. And a brilliant researcher called Paul Bacchiarita, he developed a device that fed information into the tongue of the patients, and when they moved their head in certain ways, the stimulator, the tongue stimulator, it activated different types of sensors, different patterns of sensors that the brain was able to figure out very quickly. So a big message from this video is that our brains figure out very well information that's fed into it. I suppose with sensory substitution, a very good example of this is the glasses that I wear at the moment are called varifocals, in that there are a number of different lenses in them. So the bottom third of my glass here is for me to read correctly. The middle is a different lens with different strength for me to look at a television, and the top is for when I'm driving. And when I got these glasses at the very start, I found them so hard to get used to that I was sure, and no disrespect to the opticians that we use, but I was sure they must have the wrong prescription. But I now understand from learning about the sensory substitution effect what was happening in my brain. My brain was figuring out that for me to read, a certain tilt of my head had to happen so that I looked ideally through that part of the glasses and benefit from the reading part. When I was looking at television, my head had to tilt a certain way, and when I'm driving, my head also tilting a different way. So my brain had to learn that and figure it out, and it did that within about 6 or 7 days. It had it perfectly accurate. So without me knowing, without me being consciously aware of it, my head tilts now all the times depending on what I want to read, what I want to look at. And that's a good example of how your brain can figure out information if it's sent to it. And that's what happens in sensory substitution effects. Now, our research lab in Atlantic Technological University, we've discovered that tactile sensation, so vibration sense and auditory sense, those two pieces of information, they are very good information to send back to patients' brains to substitute for other things that are going on. And I have mentioned in a previous video that it's possible to do a form of sensory substitution in your own home, but there are a number of different types of pieces of very cost-effective, simple equipment that can be used. So the first is the use of a digital weighing scales. And in chapter 17 of my Lights, Mirrors, Actions, I describe a very simple technique for patients to be able to help them to weight bear correctly using a form of sensory substitution. So standing on the weighing scales, getting a sense for how much weight is going through their affected limb, standing off, trying to recreate it is essentially the principle there, and can be used very cost effectively at home. A second type of piece of information that can potentially be used for sensory substitution are motion capture mobile apps that are available commonly on our phones. So ability to capture motion and to review it again is a sense of sensory substitution that can be used. And the third thing are what's called sensory re-education exercises that are available and that can be found on the internet and can be found in resources on my website, lightsmirsactions.com. So, caregivers, it's your job and it's part of your role to explain to your stroke survivor that sensory substitution effect is an innovative therapy that is not so well known, but it's something that's going to be coming to the fore over the next number of years, and to explain how sensory substitution potentially works. When you do this, you improve people's motivation, you improve their confidence to be able to carry out therapies at home and know that they're doing them, they're benefiting them. And this is always a big part of um, why therapy does not work sometimes, because people's confidence is always very low, especially when they're not in a specialized rehabilitation unit. So your job is to explain and educate your stroke survivor about this therapy and about the benefits. And Lightsmir's Actions talks about a very simple example and a very simple procedure that allows you to carry out this for one small pocket during the day. And the hopes are that when you carry out the sensory substitution information, it excites and it ignites the brain in a certain way that allows the potential for better and better neuroplasticity to occur afterwards. So, as I've said, if you would like some more information about what we've just spoken about, some more resources, then go to my website www.lightsmirsaction.com, and you'll find some more worksheets, some more videos that are available that will give you more information about this whole innovative therapy that's available. Thank you very, very much for listening.